Nausea. Nausea is one of the most common symptoms you will see in patients. Nausea is the feeling that you want to be sick, but you can't be sick. Or you want to expel something from your body, but you can't. Now, patients will most commonly describe this as a feeling of gagging, going to be sick, feel like throwing up. Vomiting. Vomiting is very often related to nausea or can follow nausea. Vomiting is when you are actually throwing up or chucking up. So stuff is coming out. And what we are interested in, physicians and clinicians, are these things here. Vomiting means emesis, right? And that's what it's called. It's called emesis. It means what is being thrown up, chucked up. Hematemesis. Again, this is a medical terminology term. And you are watching the medical terminology videos and taking the tests. Heme means blood. Temesis, emesis, means vomit. So hematemesis means that the person is bleh, blood. Alright? Hematemesis means bleh, blood. Alright? Whereas emesis could be anything. Food, water, bile, whatever. Right? Hematemesis means blood. Stomachache, a very, very common stomachache, a very, very common symptom. Now, patients again will describe their stomachache in many different terms. Bellyache. In ordinary English, people tend to call this area their belly or their tummy. So this will where their tummy aches. Delly belly. Delhi belly is a English expression. The capital city of India is Delhi. Delhi used to be part of the British Empire, and many English people went to live there, or British people went to live there, and they would eat the local food, and then they would have to run to the toilet because they have diarrhea. That's why it was called Delhi belly. But it means the same thing. It's all stomachache, right? Now, in medical English terms, we will call that abdominal pain, abdominal discomfort. Okay? Constipation. Now, everybody has had constipation at some time. Constipation means you want to go, but you can't go. It won't come out. So patients generally will describe that as, I feel bunged up, I'm straining, it's dry, it's hard. The medical English terms for that, well, the medical terms for that are Greek and Latin as well. But this is unusual because in my years of practice, I have never seen any doctor, any nurse, anybody ever write these things, because nobody can pronounce them. Maybe Dr. Knight will disagree with me on that and will explain that to you further, because maybe he does use that. As an orthopedic surgeon, orthopedic surgeons often look after patients that have very serious constipation problems. On the reverse side, diarrhea. Now, patients generally, well, they may say they have diarrhea, but often they will say they have the runs, the shits, it's watery, it's liquid. In medical terminology, we call it stool. Why? I have no idea. Never have had any idea, and I've never had any physician, any nurse, any educator told me why we call people's gastrointestinal waste stool. It can also be called feces. Now, feces here is spelt in the American term. If you're going to spell it in the British English term, it's Feaces. But it means the same thing, the stool. Now, it's called the runs because as you look in the picture, you're running to the toilet. Okay? And it's also called the runs because it's watery. There is no substance to it.